Lori, I'll stick around with you for a little while and hear what you're thinking about what's going on in Massachusetts. We're practically next door neighbors, Maine and Massachusetts, and we were part of Massachusetts till 1820, but we're now our own state. But we both are facing a lot of the same big issues. So what are you thinking this morning when you woke up?
Yeah, well, one, I think a continuation from yesterday, deep disappointment that Republicans aren't here in Washington. As the government shut down at 12:01 this morning, and leading up to that, our Republican colleagues were not here. They were nowhere to be found to negotiate a deal to prevent this from happening. And so, it's a grim day for our country. Shutdowns benefit no one. I think we're all eager to get back to the Capitol, to get back to work, to have those conversations so that, we can mitigate the devastation that not just that a shutdown creates, but also what these healthcare cuts are causing. So Shelley, you ask about Massachusetts. I mean, we, of course, know that if Republicans don't come to the table, if we don't act, healthcare prices are just going to surge in every state across our country. In my home state of Massachusetts, 240,000 residents stand to lose healthcare coverage, including 65,000 due to the expiring ACA premium tax credits. Another 337,000 residents will just see their healthcare costs skyrocket without an extension of those credits, which is why this timing is so important. Everyone says, "Oh, we'll open up the government and then we'll negotiate." They don't end until, or they don't expire until the end of the year. But that is not dealing in reality, because we know that insurance companies are going to be mailing out their rates for next year. They're doing that now, today, October 1st, because re-enrollment starts on November 1st. And so without an extension, without predictability or certainty, we know what happens. Those premiums are going to go up. And so when people say, like, why now? Why is this timing so important? It's because we're trying to prevent that surge in premiums. And, I've looked at a lot of data in terms of the impact in Massachusetts, and it is astounding to me that, for a 60-year-old couple who earn $82,000 a year, they're going to see their annual premiums increase by more than $14,000. That is just untenable and cost prohibitive for, a couple making that money. A family of four who earning $64,000, they're going to see their premiums rise by more than $2,500. And, someone who grew up in a family living paycheck to paycheck, that really causes anxiety around the kitchen table. It's all of a sudden you're making tough decisions on whether you're going to pay your premium and keep your health care, or pay for your utility bills, which, by the way, are up, pay for your grocery bills, which are much higher at checkout. So I think at a time when working families are already being crushed by the rising costs of groceries and housing and utility bills, they can't afford another price hike, especially one that's caused by reckless policies and a refusal to work together to find a viable path forward.
Yeah, you're absolutely right. And I'm hearing exactly the same stories from Maine. We asked our constituents for comments, and many of them have already been informed about these increases. So the numbers you're talking about are very real. One thing I found really interesting in the comments that we got, there were people who told us about double the costs. Like, they were already worried about how much they are going up, and then being, unable to buy insurance at all. But one of the things that I saw a lot in Maine, we have a lot of self-employed people, a lot of small business owners. Many of them go to the exchanges. 27% of the farmers in this country go to the exchange for their health insurance. Fishermen in my state, a lot of people who work in those kind of businesses, that's the only place you can get insurance. You don't get it with your job. And if you're lucky enough to have gotten it, And now you find out that these costs are going up. Healthcare costs are going up. But to add this injury onto it because we're unwilling to extend these credits because the Republicans won't sit down and negotiate on it, I mean, that's horrendous. And you talked about the timing. You know, how many times have we been told this is just fear mongering? This is way off in the future. Well, I'm sorry, but that is our job. Like, I don't expect my constituents today to know what their healthcare is going to look like in March. But you and I know that these costs are going to kick in. These other devastating costs are eventually going to kick in with the cost to, Medicaid, the cuts to Medicaid at the NIH, the CDC, public health. All these things are going to compound, hurt our hospitals. It's going to be really problematic how we deal with all this. And I know, day one, here we are, October 1st, those notices are going to start to go out. So many more people will hear about this.
There's no question. I mean, yesterday we did a roundtable with small business owners, right? Entrepreneurs, people who are, just creating jobs in their community through, through their small businesses. And they're going to be severely impacted by premium hikes, right? I mean, this is where so many people get their health insurance is on the marketplace. It allows people to start their own business, and they're going to get priced out. Either they're not going to be able to insure themselves and their family, or they're not going to be able to extend healthcare to their families. And that has a huge ripple effect across our economy. I mean, we know what happens when people who do drop their insurance because they can't afford it. Many of them are going to roll the dice. I've got boys who are, 27 to 32, and they're going to just roll the dice and say, hey, I'm healthy. I'm not going to sign up for insurance. That ER visit that they go to is going to be more expensive for all of us. The pool that's left is a sicker pool that is more expensive to insure. That means all of our premiums go up. I mean, it is just so irresponsible. And you're right, Shelley. I wouldn't expect anybody at home to be looking at the deadlines and the milestones that we're looking at, but that's what we're paid to do, right? We are paid to come and take a long-term look to protect people from, surges in prices or lapses in coverage. And we're already seeing a healthcare crisis because of this big, ugly bill that was passed into law this summer. I mean, in Massachusetts, we got screwed over by Steward Healthcare. I have a hospital that closed in the heart of my district in Neshoba Valley. When a community hospital goes down, there's no plan B. There's nothing you can say to alleviate the anxiety of people who are wondering, am I going to get to an emergency room on time? How far do I have to travel to get urgent care? Or, it wreaks havoc, and we're already seeing it. Hospitals are shuttering services, their least profitable services, right? We're seeing maternity deserts across the state. So when you compound that, the Medicaid cuts that are creating a ton of instability across our healthcare system with the ACA tax credits and not extending those, you're just creating a dire situation for families who don't deserve it. And the fact that Republicans aren't here trying to solve that problem, misrepresenting what the problem actually is, using ridiculous talking points to say Democrats want to just extend health care to people who are in our country illegally. That is not what this is about at all. And the fact that they think that they can get away with lying to the American people that way is just, it's abhorrent. So I know we're here. I know we're going to talk about, the families and the real people who are impacted by these cuts. And it's on us, community by community, to make sure that people understand that this is a fight that we have to, go to battle for, because if we don't, what we're going to see is just a crumbling of our healthcare system that's really going to impact the people we represent.
Yeah, I've never seen, obviously, we've never seen this large of an attack on the healthcare system all at once when you combine all these things. And you talked about hospital closures in Maine. Most recently, we lost the Waterville Hospital. That's a fairly significant city. I know it's nothing in Massachusetts, but, Our largest city is only 60,000 people, but Waterville is an important community. They had to shutter their hospital. That means longer drives for people who live in that area, but also we're a very big rural state. And so people are already traveling a long distance to get to their hospital. And we've already had the same issues you were talking about, these maternity deserts now. And you've had kids, I've had kids. And the idea you might be an hour and a half away from the hospital now, that's a panic item for that family. So does that mean you say, well, I'm going to move out of that community? Or how's that going to impact those surrounding communities that are no longer stable, or the employers who worry about their workers leaving the jobs because they're like, yeah, my grandmother's sick and I don't want her to be that far from the hospital if something happens. I mean, these are big issues in rural states, but also in urban areas where you need the coverage, you need emergency care, you need all these things. And that is a real impact that's already worrying people in our state. I mean, when you have a closure, people immediately say, oh shit, that's what it means. What it means when the hospital closes, the place I'm used to going. And it's our job to say, look, you can't cut all these places at once. You can't just say, we're going to take this much money out of the system. And as you said, they're only arguing back. They're not in the hallways. They're not with us. They weren't in the chamber yesterday. And they're just arguing back with these falsehoods, like saying, oh, the Democrats are just putting this to illegal immigrants' health care. And that's already illegal. That's not part of this conversation. I saw a post yesterday where they said, came out from the Appropriations Committee. I'm on the Appropriations Committee. And this was the Republican side saying, we've got a $1.5 trillion wish list that we just dreamed up overnight. Not true. Right. And if we're talking about over $1 trillion, that $1 trillion is actually what you took out of Medicaid, Republicans, to give to tax cuts to the wealthiest. I mean, we're talking about a real healthcare system. Yeah. And I remember back, you were talking about your sons and the pool. I remember back when all of our calculations around the Affordable Care Act was to say, how do we get everybody back in the pool again? Because young, healthy people weren't getting healthcare. It was too expensive for them, but they were taking a huge risk. And now we're seeing all the stories of, younger people being diagnosed with cancer. So if you don't get those early screenings, you might be 28, you might be 32. But if you didn't get your mammogram or your colonoscopy or the things that you might need, then all of a sudden you don't know. And these are scary times. So you take away the screenings, you take away NIH, you take away cancer research. We are doing serious damage. And over the next 2 or 3 years, as all of these things, cut in, and get impounded, if we're not able to stop them, we're not doing our job for our children and future generations, and the responsibility that's on our shoulders.
Yeah, you're exactly right. I mean, what brings the cost curve down in healthcare is when people co-produce their care, when they go for their primary care visits, when they go for their annual checkups, when they go and have an early diagnosis or preventative care. I mean, that's what we want people to do. You need insurance to go and do that. And if people don't do that, the costs skyrocket, right? We're going to have sicker people. We're going to have people who are diagnosed later, which is an enormous economic burden. I mean, the whole point of giving people insurance is so that they can, exercise, preventative measures. They can go see their doctor, and they can, be healthy and understand what that will, take and get on a routine. This is exactly the opposite direction from that. This is going, and the fact that Republicans aren't talking truthfully about how that impacts everyday Americans. I mean, there won't be a person who doesn't see an increase in their premium, and you can't dismantle a system without putting another solution in place. And that, I think, I've been watching Republicans rail against the Affordable Care Act since it was enacted. You've obviously been there in the fight since the beginning. They've never had an alternative. Their alternative to giving people the health care that they deserve and they need is zero. It's about taking away. And that is a huge disruption to our system. So, I mean, I think one of the things you hit on, maternity health deserts. We're already seeing that across our country. I mean, women are just disproportionately impacted when these when these cuts are enacted to Medicaid and to the ACA, and women, particularly pregnant women, and children battling rare diseases. So I think when we talk about the Republican healthcare crisis, these aren't just numbers on a spreadsheet. These are your family members. These are real people, and women in particular are going to be hit hardest by the cuts. And I think it's important to start with the basics. Medicaid isn't some government/fund. It's the largest single payer of maternity care in America. Nearly half of all births in this country are covered by Medicaid. So that means your prenatal checkups, your ultrasounds, your, safe deliveries, postpartum care. And that means the difference between a healthy pregnancy and a dangerous one. So when Donald Trump and Republicans cut $1 trillion from Medicaid, they didn't cut waste. They cut the very care that millions of women depend on when they're bringing a child into the world. And this comes at a time when America is already in the middle of a maternal mortality crisis. The United States has the highest maternal death rate of any developed country. Women are dying at rates we simply should not accept. And the risks are even higher for Black and brown women, who are 2 to 3 times more likely to die from a pregnancy-related complication. So cutting $1 trillion from Medicaid doesn't just ignore the crisis, it actually pours fuel on the fire. So I think you represent rural communities. If you think about what this looks like for a woman in a small town whose local hospital is already struggling to keep its door open, that hospital relies on a Medicaid reimbursement to keep its maternity ward running. And that when that funding is gutted, the ward shuts down. And so as you so credibly pointed out, now the closest place to deliver a baby might be an hour or more away, or to get that ultrasound or that prenatal care. Right. I mean, that's not just inconvenient, it's dangerous. So it really is. I think one of the things that yesterday was so important leading up to the stroke of midnight was all the voices that we heard. We, of course, heard from small businesses. We heard from parents with kids with disabilities. We heard from women. We've just heard from people who put a human face on Medicaid and a human face on the premium tax credit that they use to get their health insurance through the marketplace. And when you multiply that across the country, we're talking about millions of people. And that is why I can't understand how Republicans, there's no averting your eyes here. This is the issue that they have to face and that they have to work with us on, so that we are not allowing a healthcare crisis to just get worse in our country.
Yeah, and you were talking a little bit about people not understanding necessarily what all these wonky things mean. Medicaid, to some people is like, oh, that's just poor people who don't go to work. But as you said, it covers a huge segment of our population, at least a third of the people in the state of Maine, often, children with a disability. In our state, we call it Maine care. So often people say like, well, I don't care about Medicaid. And you're like, well, do you get Maine care? It's like, oh yeah. That's been great. It's really helped me to make sure that my kids got coverage and that I could take them to preventative care. But also Maine is the oldest state in the nation. We're not proud of, well, we're proud of it, but we're also trying to, get more young people into our state. But the issue is that means a lot of people spend their final years in a nursing facility or some kind of long-term care where, most people after 6 months run out of their savings and then they're dependent on Medicaid. And we've seen a lot of closure of our long-term care facilities because yet again, there's not enough reimbursement. It's hard to make ends meet. People think, oh, that's Medicare. It's got me covered. No, it actually isn't. That's Medicaid. And so your grandmother or you may be dependent soon on this. Not you, of course, Lori, but there are going to be many people, and I know in my state. Anyway, it's a huge issue. And I think a lot of times people don't understand that is a vital part of our healthcare system, is taking care of our seniors. That's where a huge percent of our healthcare costs occur. and that is covered by Medicaid. So once again, we get caught up in sort of the myths and the lies. Oh, this is just, making lazy people go back to work. That's all we're doing in the $1 trillion cut. Well, that's not $1 trillion. And in fact, for a lot of the states that have tried the paperwork solutions that these guys are going to burden many of our workers with, I think both Arkansas and Georgia found that these systems don't work when you make people do more paperwork and reporting. I know in my state, again, because we have a lot of people who work independently or work in the woods or go fishing, they don't get a computer generated paycheck every month. So having to report your income is incredibly burdensome. And what they found in states like Arkansas is if it's too much of a burden, people drop it. So it wasn't that they didn't deserve the care. It's that these crazy paperwork requirements were so complicated and you didn't have enough time at the end of the day after you're putting in time on your job and picking up your kids from school and making them dinner and all the other things you have to do to fill that in. And so suddenly you join the pool of uninsured. And going back to why we had healthcare reform in the first place, going back to the early Obama days, was to say, how do we get everybody in the pool? How do we have universal coverage? It should be a right in our country. We shouldn't even be debating this. And this is a way of dismantling it in a very sneaky way that says, well, we'll just take a little of this and we'll just take a little of this. And before you know it, you get a year from now and you're looking at it and you're like, this is just an empty shell. The money is gone. The people are gone. You can't administer these programs anymore because they cut all the staff, but the states don't have the money anymore. And I'm worried about, my state of Maine, when they have to deal with these cuts to Medicaid because the state pays in a share, and to compound that with the SNAP benefit cuts and the last 9 months of all these illegal and unconstitutional cuts that they've made to Department of Education, to the EPA, across the board. I used to be a state legislator. When they come back in next January and start looking at their budget needs, like every other state in this country, they're going to say, holy shit, what are we going to do? Because, we don't have the tax dollars to do this.
That's right. It's going to blow like huge holes in state budgets across the country. And I'm glad you brought up Arkansas and Georgia. I mean, we obviously debated this on the Energy and Commerce Committee and the Healthcare Subcommittee. And the only thing that increased paperwork caused was for people who were deserving of healthcare to lose their healthcare. I mean, that is literally like if you just, if you read all the data and that is the net of the story of those, case studies. It was people who deserve to have healthcare lost their health care. And that is unacceptable. You talk about seniors, and I'm glad that you did, because we're seeing the same thing with assisted living centers. They're in a full-blown panic around if they're going to have to shutter. But let's talk about another group that is uniquely vulnerable in this healthcare crisis, and that's children, especially children who are battling rare diseases. I mean, I think for families who are raising children with serious or chronic conditions, healthcare coverage isn't optional. It's right. Not just a nice to have. It is a difference between life and death, and the difference between a child growing up with a fighting chance and a child going without the treatment that they need to survive. And Medicaid, the Children's Health Insurance Program, those are lifelines for families. They cover the pediatric specialists, the hospital stays, the feeding tubes, the therapies, the seizure medications, all of the things that no parent could ever plan for, but that every parent would do anything to provide if their child's life depended on it. And when Trump and Republicans gut Medicaid by $1 trillion, they're not trimming around the edges. They're ripping away that lifeline. And, we've got Boston Children's Hospital for children who were born with congenital heart defects, cystic fibrosis, rare forms of epilepsy. That cut translates directly into fewer doctor visits, delayed surgeries, missed treatments. And, and for parents, which we're both parents, it just translates into sleepless nights, wondering how to pay for care, how to keep the lights on, how to give your child a shot at a healthy future. That's like, it's just unthinkable that we would put children with rare diseases in that position and their families. But there's also millions of children who rely on routine care, right? Checkups, vaccines, school physicals, so that they can grow up healthy. And when families lose coverage, those basic services become luxuries, right? Kids miss their immunizations, ear infections, go untreated, asthma gets worse. I mean, small problems become big ones, and those big problems end up costing families more. They cost hospitals more. And ultimately, the way our healthcare system is designed, it costs all of us more. So the expiration of the tax credits are going to make that worse. Families who don't qualify for Medicaid but still rely on marketplace coverage, and for us in Massachusetts, it's Mass Health, they're going to see their premiums skyrocket. And for a middle class family, that could mean thousands of dollars every year. And at a time when, I know families that I represent, they're already stretched so thin. That is the difference between keeping their coverage or losing it entirely. So this is, this is what this is about. It's about families who are already living on the brink being faced with just the unthinkable, not being able to keep their family safe and healthy.
Yeah, and your position on energy and commerce is so helpful because you've been, through so much legislation and the hearings around all these things, and you see the, the breadth of what's going on here. We, again, as Mainers, we are really grateful for the Massachusetts healthcare system, and I've met so many kids with rare diseases and cancer. I have a close friend who's got a daughter with neuroblastoma and really takes advantage of the services of Boston Children's, and it's so vital both to have that coverage as a family, to have Medicaid coverage, which kicks in, but also to have the vital research. And you've seen what they're doing to cuts at the NIH and other research. And this is one of those areas where I think, if this wasn't in Washington, and we weren't just talking to the Republicans who don't even show up, but Americans in general, Republicans, Democrats, and independents, everybody would say, I want my tax dollars invested in curing childhood cancer. I don't want to see one more, sick child. I don't want to think about one more family that has to go through this and the devastation that there is there. And it's like we're in charge of investing your tax dollars, and we're just trying to make sure that everybody knows. Do you understand this is what's being taken away? And it might be your next door neighbor or your grandchild or your child. But everybody cares. Even if you don't even know a child who's been sick,
That's
everybody
right.
says no one should go through that. And every family should have access to all those vital services. So in many ways, all we're trying to do now is just say, hey, if the Republicans won't tell you this stuff, we just want you to know it's about your grandmother. It's about your next door neighbor. It's about how your, college age kid is going to make sure that they continue to get healthcare coverage on their first job that doesn't cover it. And one of the things that I've seen that I think is really interesting from what the constituents have been telling me is there are families that are making, $80,000, $90,000 who are looking at these increases and saying, wait a minute, I got a kid in college, I got a mortgage. This is more than my mortgage. I can't afford healthcare coverage anymore. And somebody else who said to me, my costs are going up $100 a month, but $100 a month for me is way too much. So whatever level you're at, these costs could impact you. And this is going to interfere with everyone's life. And then all the people who don't even know that their costs are going to go up because of the whole way the pool works. This is going to be very broad-based level of devastation, from research to public health to the CDC. And then, here in these Affordable Care Act coverage that we're going to lose on the exchange. People are finding out today.
They are. And, I think in Massachusetts, especially because you represent, so eloquently just sort of described the healthcare ecosystem that, our economy relies on in Massachusetts, but also where we find the next cure, the next treatment through our life sciences sector, which is world-class. It's sort of the life science capital of the world, dependent on NIH grants. Those partnerships with academic institutions that are really on the cutting edge of research, spawning companies that are really coming up with, the cures for so many of these chronic illnesses, and then just our hospital infrastructure. I think people in Massachusetts, they understand what these cuts mean because they're already seeing it. I mean, Shelley, I know you're already seeing the warning signs. Rural hospitals are closing because before this $1 trillion cut, they were already in the red. Community hospitals in communities like mine, they're stretched to the breaking point. They're already cutting services. A community health center in my district is laying off employees. And look, I want to be clear that the Trump administration, they knew this would happen when they passed this bill. They knew it. And, I do sit on the Energy and Commerce Committee. Just a few weeks ago, Robert F. Kennedy Jr. testified before us. And I asked him directly, what's the plan here? If Republicans are blowing $1 trillion hole in Medicaid and letting healthcare coverage costs skyrocket, how exactly are they planning to keep hospitals afloat? And you know what? He didn't have an answer, and they've never had an answer. Instead, Republicans created the so-called Rural Hospital Fund, right? $50 billion, as though that's going to, fix things. And they like to point to it as proof that they're trying to fix the very crisis that they created. But that fund is a Band-Aid on a gaping, bleeding wound, right? It doesn't even come close to making up for the damage that they caused when they decimated Medicaid, and it's woefully underfunded. And so J.D. Vance has the gall to stand there and act like this is the thing that they're protecting. It's not. They're protecting tax cuts for the billionaire donors. And the policies that they passed, like cutting Medicaid, that is what's paying for it. And so, I've already seen the consequences firsthand in my own district. I mentioned Steward Healthcare. They were a giant for-profit corporation. They ran hospitals into the ground so that their CEO and their executives could line their pockets. And 4 hospitals were slated to close, 3 of them in my district. And despite our best efforts, one of those hospitals did close permanently last year. And what that does to a community is beyond comprehension. It means that patients have to travel an extra 30 or 40 minutes for life-saving care. First responders having to transport people in need even further, wasting critical time because, they have to go further in both directions. The next closest hospitals are suddenly overwhelmed. They're stretching already thin staff and resources to their limit. And that burden is just insurmountable. The devastation is real. And I promise you this, communities across the country are about to experience the exact same challenges as this Republican healthcare crisis gets worse. Look, House Democrats are here in Washington. We're fighting tooth and nail to stop this crisis. We're working every day to protect people's healthcare, to shore up our hospitals, to push for real solutions. But Republicans aren't here. I don't know where they are. They're on vacation, they're at home, but they're not at the negotiating table. They're not listening to folks who are about to get hurt. And what that signals is that they don't seem to care about the very real consequences of their own action. And that is what this fight is about. It's about working families, seniors, kids, communities across our country getting the access to the care that they need.
Well, it's been great doing this and talking with you, Lori. I appreciate my colleagues so much. I appreciate the great work that you do on energy and commerce, and just can't say enough. We're here in Washington. We're going to be connecting with our constituents even more and saying, how is this impacting you? And we're going to be asking our Republicans every day, please come back to the table, because a shutdown isn't good for anybody. But neither are these healthcare cuts. So we're going to keep fighting. I think we're going to pass it off to the next people coming along. And I will say goodbye. And I think,
Kelly,
this has
thank
been
you so much. Yeah, thank you so much for your leadership. You've been in this fight a lot longer than me. And so, the ins and outs of, these cuts as an appropriator. But I treasure your partnership and your leadership, and really enjoyed the conversation and just kind of breaking it down so people can understand what's at stake.
Yeah. Well, great talking to you. Thanks so much. And thanks to all our constituents who are out there letting us know what they're experiencing and fighting back with us.
Thank you.